Twist that knife, Governor Cuomo, twist that knife. Well, looks like America's governor has just backstabbed America's healthcare workers, especially the ones that are trying to help him in that state right now fighting the coronavirus. Uh, let's, um, let's go a little bit here to Fox News 13 out of New York. Healthcare workers who came to New York to fight the coronavirus must pay state income tax, Cuomo says. Now, I worked as a travel nurse in New York State. I was there for a couple of years. Most of that time I was taxed. I was taxed in my home state in Texas, so I really didn't get I call it penalized, but I really didn't get taxed in state and by in New York City for almost 2 years, up until my last paycheck. My last paycheck, I actually owed New York State money, and but when everything is all said and done, I probably paid more than half of my paycheck to taxes in New York State. So the governor saying this makes me really livid because many of these healthcare workers, many of these nurses, this respiratory therapists, physicians who travel there to help out, they risk their lives going there. They signed up for it. They risk their lives. They ought to be paid. They earned it. But seeing this, the governor says that they ought to pay state taxes because he has on a budget shortfall. That is not their fault. That is the fault of the mismanagement of your office, Governor. So let's take a look and see what's going on over there in New York and why the governor is backstabbing the healthcare workers. And I say that strongly because I am very livid about this right now. Healthcare heroes who came from around the country to help fight the coronavirus outbreak in New York will still have to pay state income taxes, according to Governor Andrew Cuomo. The taxes would also affect Samaritan's Purse, a Christian aid organization set up a temporary hospital in Central Park. We're not in a position to provide any subsidies right now because we have a $13 billion deficit, Cuomo said during his daily press briefing on Tuesday. So there's a lot of good things I'd like to do, but if we get federal funding, we can do, but if it would be irresponsible for me to sit here looking at a $13 million shortfall deficit and say I'm going to spend more money when I can't even pay the essential services. So he calls it. Let's see. It says here he calls it subsidy, as if they have the right to what these healthcare workers have worked for. Basically, he's saying that everything that you have worked for is their property, and you're lucky to have a piece of your earnings back. Is that what he's saying? Because that's how I certainly got it. And not only is that unfair, but it's very insulting to a lot of workers who go there and travel there and help out. So I would say this: not only for the travelers that they deserve tax cut, or at the very least be taxed at their home state. I would also argue that the workers over there, the healthcare workers over there in New York, who have been treated very badly, mind you, for many years, not only by the state, but by the corporations they work for, that they deserve to have a tax cut as well. They have risked their lives. They signed up for it, but they also risked their lives to serve their community in this time of crisis. They've gone above and beyond the call of duty sometimes, and some of them have died. So I don't know what to say sometimes, but reading this morning, I'm very livid. But there may be more to the story that was being said here by the governor. So let's go to Twitter real quick and see what is being said here by Ellen Carmichael. Of course, she reiterates insanity. Cuomo confirms healthcare professionals came to New York to help fight the coronavirus pandemic will be forced to pay New York state income taxes, citing the state's $13 billion budget deficit and a need for tax revenue, which is ridiculous because it's not their fault. That mismanagement is completely from the governor's office. But she says also, don't be fooled. This is meant to scare federal lawmakers into giving a state a bailout, but he's willing to exploit healthcare professionals who volunteer to come to New York to make a political point. It's gross. I love all the people being like, but they work here, they need to pay taxes here. Absolutely brilliant. Or could it be that Como said it is because they have a budget shortfall and they can't cut people who volunteer to work in their state a break? Some of them have even died. And to all the lecturers, I'm very well aware that states like New York require you to pay tax to them even if you don't reside here for 180 or more days. They chase part-time residents down to make sure they pony up. You're not telling me something I don't know. Thanks. I want to make it abundantly clear, yes, everyone knows New York tracks down anyone who works a minute in their state to get their hands on tax money. But in this case, this is not what it's about. Cuomo is calling potential tax relief subsidies, quote, quote, and using it to ask for a bailout. To make it even clear, Trump has floated some sort of hazard pay or other relief for medical professionals. Cuomo and de Blasio are demanding massive bailouts. This is just a way for them to make their case. It has nothing to do with negligible tax revenue they get. And there you have it. This is, I tend to lean towards that if he has a budget shortfall, that is on them. That is on the state government of New York for not managing their budget correctly, and they've had long-running corruption and budget problems for a long time. You know, they spend money that they didn't have out of the backs of the taxpayers, out of the backs of the workers, and now they're going to tax people who are trying to help them. Please. Well, that's all I have for right now. Please join me next time as I do more commentary and analyze what's going on in the news. Please hit like or subscribe, and please comment below. And thank you for joining me today.